So tell us your name and your credentials.
So my name is Jeff Szymanski. I am trained as a clinical psychologist and for many years treated people with obsessive compulsive disorder. I worked at the OCD Institute at McLean Hospital, which is a residential facility for people with OCD, and probably saw about 1,200 people with OCD and treated individually maybe 300 or 400 people with OCD. Now I run the International OCD Foundation, and that was I was the director of psychological services at the institute, and now I'm the executive director of it. I think the other thing that's happened, particularly in this country, is there's something about the words of it. So obsessiveness as a personality trait means that you think and you worry a lot, and compulsiveness as a personality trait means that you're detail-oriented and organized and et cetera. And so, you know, in pop culture in this country, we see a lot of, I'm so OCD because, but it's like my pencil is you know, misaligned. And so it's become a little bit of this kind of catchphrase. And so the problem with it being a catchphrase is that if I'm saying, oh, my OCD is acting up, but I don't really have OCD, then it gets kind of diminished. So when someone truly has OCD, I go, oh, well, I'm a little OCD. And so I think that person has OCD too, so they should just be able to stop it in the way that I can stop it. Well, you don't have a disorder, you're on a personality trait continuum, and it's a different issue. And so I think that it gets minimized and diminished, not meanly, but it's just a lack of understanding and a lack of information about it. It's truly a mental disorder.
And someone could be obsessive compulsive and still not have the disorder.
Correct.
That's still a possibility.
Absolutely, it's a possibility, and that's part of the problem.
And how many people do you think are affected in the United States with OCD?
So the best estimates we have is that about 2 to 3 million adults currently have OCD, and another 500,000 to 1 million kids have OCD in this country.
You know, when I first had OCD, one of the things I thought was, I'm going to end up in an asylum.
Mm-hmm.
You know, I was so afraid, and I had a psychiatrist who said, well, why don't you go to the hospital, to the psych ward,
mm-hmm.
and have them observe you for a few days,
mm-hmm.
you know? And my parents started crying, I started crying, because my godmother started crying, she was mm-hmm. with us, and we were so upset to hear that. But how often do people say, well, they treat OCD,
mm-hmm.
but end up giving that diagnosis to other people? And what do you think about that? You know,
well, one, I've never seen anyone go into an inpatient unit with OCD and that inpatient unit be able to treat their OCD. So I never saw that to be effective. You really need someone who knows how to treat the disorder and has some specialized training in it. A typically trained mental health professional is not going to be effective with OCD. That said, a psychiatrist, if you go to a psychiatrist, in general, they know if they ask the right questions and they can diagnose you with OCD, they can get you on a medication that may be helpful for your OCD. But in terms of, you know, psychotherapy, you actually have to have a specialist. And, you know, we do have a treatment provider database, and they are self-identified as people that treat OCD. And we've run into problems with people saying, yeah, I treat OCD, but maybe they do and maybe they don't. And so we put a checklist on our website and say, here are the questions you need to ask when you call a treatment provider that will tell you whether this person really knows what they're doing or not. Because you won't get better if you don't get the right kind of treatment.
And can you just give out your website and your, where parents can go to? What are some of the resources parents can go to get help for their children with OCD?
So the best place to go is to our website. It's www.iocdf.org.
Okay, and they'll find all the resources there.
There's tons of resources. We have just general resources for OCD in terms of education, and we have all those databases that I mentioned. We have information specific to kids with OCD, and we have a website devoted just to hoarding disorder, and we're going to be launching a website devoted just to body dysmorphic disorder. So there's a ton of online resources for people to go to, and if they just go to the iocdf.org website, they'll find them.
And you'll be able to find like a local OCD center in your town from the IOCDF website.
Exactly.